Dr. Stefanie Frank. I'm children's doctor since 35 years, and I have my own office since 15 years. Before I was in intensive care at a big hospital here in Germany. I want to tell you something about our health system. So we start with the newborns. When a lady is pregnant, she's having a lot of checkups before the baby is born. Usually the baby will be born in the area where she had the checkups. And the most children who are born in the hospitals, usually not at home, but some modern parents like to have it at home, so the midwives do it at home as well. After the birth, the children have several checkups. It starts with the first day, and then we have another one at the 3rd to the 5th day, and another one which will be after 3 to 4 weeks. We call it U1 until U3. And this time the children are always checked up, the body will be checked up, they will be vaccinated if possible, if necessary, they will get vitamins and everything. And we make always ultrasounds in the children of the hips, because there are severe diseases of the joints. And they will be done usually twice, and the mothers will be discharged usually after 3-5 days at home, and the midwives will come until they have discharged at home for the next 6 weeks, every day or every week once, dependent on the child and the mother. And it's something the government will pay or the insurances will pay. So the people, they don't have to pay it. And usually in my practice, in my office, I will see them when the children have no problems. They will come in when they're about 3 to 4 weeks. Until this time, they have started with vitamin D and are usually breastfeeded. The breastfeeding is the natural way to give the child enough energy and all they need. So in Germany, usually the children are breastfeeded, but they can be fed by formula as well. And after the 3-4 weeks, I will have the checkup U3, and after this they will follow a lot of other checkups until the children are 16 years old. Usually after every year they get always one. It's always paid by government or by the insurances. If you have no income, you will be insured over the government. If you have income, you can decide between private and common health insurances. But the private insurances are more rare than the common. And the common insurances are not really different to the private things you can have in hospital or in other healthcare things. So you don't have to decide for the private. And the private one you have to pay, and the common one usually are paid by the employer or by the government. So if you are private insured, or if you are not insured at all, and you have to pay private. Usually nobody is not insured in Germany, but sometimes we have guests from other foreign countries. Then you have to pay by your own. A simple checkup or whatever will cost about 100 euro. It's not too expensive in children. But if you have if you have to have other examinations, or like ultrasounds or blood controls or something like that, it can be more. In hospital it's more expensive to pay by your own, but as I said, in private or common insurances everything will be paid. So it's no problem to have any disease, and you'll be on the sure side of the life.